bariatric surgery in many centers and in our center as well, a team approach is critical and it is very important. It's very similar to a transplant team. We have a very experienced nurse coordinator who has worked with bariatric patients in all aspects of the care, including the pre-surgery process and the very hard work that patients have to do with the insurance process. And we understand that is a daunting task. And so we expect to have to help them to some degree in terms of that. Our physician assistant is also very experienced in the preoperative care, the postoperative care, in the pre-surgical medical workup, and also is an expert assistant in the operating room and has well over 10 years experience in this field.
Here at Georgia Regions Health, we have an excellent team from top to bottom in our program. Dr. Lane is a very experienced surgeon who started out in the military and then has since been in both private practice and academic surgical settings, meaning he's worked with residents, he's worked with students, he's trained young people for many years, and he's done just about every operation and has seen had a very unique practice working with some very innovative people himself. And so I think we're very fortunate to have him as the director of the program. And myself, having my background from Duke and having done several hundred bariatric cases, I think I offer sort of another viewpoint into the surgical process. Nicole Moore is our dietitian. She does a wonderful job explaining the ins and outs of good health and explaining what foods are safe at what time after or even before a bariatric operation. Our psychologist, Dr. Lamone, he's been excellent and is very well experienced in helping bariatric patients, both before surgery and after surgery, kind of navigate the many kind of difficulties surrounding surgery. We have to remember that obesity it comes with some baggage. It comes with some stigmatism.
The disease can return in medical obesity, similar to diseases such as cancer can recur. So we have to be poised to help these folks lifelong. So the team approach and sort of the cancer model, a transplant model approach, I think is very appropriate for how a center should approach the bariatric patient.